can all hear me clearly. So let me start. Firstly, I want to, thank you all for coming here and your patience. I think it is a very important international conference. This is the second one, and we are from the UNDRR, United Nations Office for Disaster Risk Reduction, headquartered in Geneva, but here in Incheon in South Korea, we have the Global Education and Training Institute. We have been working with APDRC right from the beginning when it was, in fact, it was only a concept. Since then, we have been associated, so it is always a privilege. I will be talking about disaster risk reduction, the Sendai Framework, and introducing a tool which is very relevant in these days of COVID-19. And in case any of you are interested, we have online training, or we also have face-to-face training for this. So you will show the slide. Oh yeah. Yeah, okay, sorry. So yeah, so let's start with the basic understanding is that disasters are not natural, which means that it is our behavior which determines. So for example, if we build with a bad building code or don't follow a building code in an earthquake prone area, then that is a disaster waiting to happen, which has happened because of our behavior. Similarly, pandemic, you might think, pandemic, is from nature. We didn't create it. That's true. But the Sendai Framework in 2015 talked about biological hazards and how countries and cities and everyone needs to prepare for the pandemic. So that is an issue that we have ignored. There has been Ebola, Zika, MERS, SARS, so many warning signals. But unfortunately, at a global level, we did not prepare. And now we are learning in the crisis, which is not the best way to go about it. So disasters are not natural. It is our behavior which determines the impact of that disaster, and it is us who has to change our behavior. And I hope after this COVID-19 situation, we will learn the lessons and we will be better prepared in the future. So we look at the Sendai Framework. As I mentioned, this is the overarching framework which was negotiated in Sendai by all the countries around of the world, and it was adopted in 2015, and it is valid till 2030. And interestingly, the Sendai Framework mentioned very clearly for the first time in a global framework that biological hazards pose a threat, and they need to be discussed and planned for by governments. Now, when we look at risks, we see, firstly, we see the events such as earthquakes, floods, cyclones, pandemic. These are the disaster events. But we also have what we call chronic stresses. So chronic stresses are factors which enhance or increase the impact of that disaster. So for example, it could be economic, as we are seeing even in the COVID-19. Poor people are impacted more. People with lower nutrition are impacted more. People with other sicknesses are impacted more. So those are the chronic stresses. and they interact with the disaster and they make the situation even worse. Now, when we look at specifically for pandemic, we see that, for example, people living in poverty, they are more impacted by COVID-19. How? So, because of COVID-19, there is a lockdown or there is reduction of business and commercial activity. Now, the poor people, they are dependent on jobs, they are dependent often on daily wages, and when this stops, then their income comes to zero, their livelihoods ends, and they are not able to live a decent life. So the chronic stress, which is poverty, is made worse because of the COVID-19, because of the pandemic situation, and vice versa. The poverty makes the impact of the COVID-19 more felt. So we see that these two interactions, which are very important in our planning processes. So basically, when we look on the left side, these are the driving risk drivers which we need to reduce. Now, again, we have to understand that when we talk about a government, it could be a national government or a local government. The disaster management part is usually within the, you can say within the civil defense or the emergency department. But a government is not one sector by itself. It is a system of systems. So even in this example, what we are seeing here, so for example, the healthcare system. Now the healthcare system is a full part of the government, and if we treat any of these sectors independently of the others, then we will fail. And COVID-19 has brought it out very clearly. For example, the COVID-19 is a virus. It causes a sickness. It causes some people to go to hospital and receive medical care. It causes overwhelming of hospitals. So to that extent, it is related to the health sector. But apart from that, it impacts transportation. Airports, many airports around the world are closed right now. Airlines are not working, or they are doing very few flights. Even in Korea, the number of flights before COVID-19 and now are very less. So it is impacting even the airline industry. It is impacting the jobs which that industry provides. It is impacting tourism. It is impacting restaurants, cinema halls. So the impacts are much more than just the health sector. And that is because every structure, every administrative unit, every government, it is a system of systems. It is not, individual departments. So we have to consider that the health system is also, or the health department is an integral part and should be an integrated part of all planning. So now coming to some simple tools. So we have since 2017, we are since 2010 actually we are running this global campaign called the Making Cities Resilient campaign, which is focused on local governments but also linked with national governments. Since 2017, we have a tool called the Disaster Resilience Scorecard for Cities. And basically this is a simple checklist where cities can do some scoring and determine where they are as far as resilience is concerned. And this is an example of what the scorecard looks like. So it has a subject, it has some question, and then it has the ranking. So you can score from 0 to 5. 5 is being best prepared and 0 is not prepared. And then it has some explanations. So this scorecard is freely available in many languages, including Korean, but also currently about 13 languages it is available. It can be downloaded from the Making Cities Resilient campaign website, which is here. Now, when we look at the health, the systems again, so we have the campaign, we have the scorecard, and we have another tool called the public health scorecard. So the public health scorecard today is very relevant to all governments for managing the pandemic, and it works very well with the World Health Organization guidelines also. Now the public health scorecard I will talk about and I'll show you in a while, but it is kind of an annex to the original city scorecard. Now, what the public health scorecard does is it talks about the interconnectivity of different systems. So here you see in the center is the public health, but then it includes law enforcement, it includes hospitals, schools, neighborhood organizations, non-profit organizations, elected government, employers, public transit meaning like the public transport systems like buses and metro and so on. So all of this, so the public health scorecard tries to interconnect all of these entities. And these are some of the issues which are covered in the public health scorecard, including for example, capacity. So, and we have seen in the COVID-19, one of the biggest challenges is that the health systems are overwhelmed because of the number of cases. And they run short, there is shortage of doctors, nurses, and technicians, and even beds and equipment. So the scorecard looks into these capacities, it looks into recovery, it looks into planning. So all kinds of aspects are covered by the scorecard. And these are just some of the examples of questions. So for example, does risk planning include the health department? Now this we have found in many countries, in many cities, in many local governments, it has been missing. When they did the risk planning, they did not include the health department. And now that those weaknesses are coming forward. So what we need to learn from COVID-19 is that any government is a system of systems, and all these entities, all these sectors, all these systems need to talk to each other. They need to communicate with each other to ensure proper planning for resilience. Again, here it asks about the surge capacity. So as you have seen all over the world, including in some of the most developed countries, the surge capacity has become the biggest bottleneck. Now again, these are examples of other questions. These slides are with you, so and they are self-explanatory. But here, if you see 9.4 talking about the equipment, which is again which just the earlier speaker Gwen also talked about, that we are now more used to using this equipment, but it is also a fact that it is in short supply in many countries. So These are some of the sample questions. These are just for your information. I'm not going to talk about them, but these are what the questions look like. Again, the subject, the scale, the assessment 0 to 5, and the comments. These are again looking at availability of public health workforce. And this is looking at the surge capacity. So it has, the scorecard was developed in 2018, so it is not in response to COVID-19, it was there even before. Again, which emphasizes the fact that this is an issue which has slipped through the cracks. It has been unfortunately not given the priority it should have been given. It is developed along with the World Health Organization. This is also free to download, and it is available currently in English, Arabic, and Spanish. But maybe by end of July or early August, we will have the Korean version also. So we can, so you can download that. Also, we provide training, simple online training for this. So if anyone is interested, please let us know. Now, how can this scorecard be used? So you use the public health scorecard. You know, the objectives will of course be to develop an action plan to deal with the pandemic, identify the stakeholders, because it's not just the health department then, it's also the emergency management department, it's community organizations, it's the private and public hospitals, the Red Cross, and so on. All of them will be the stakeholders, or the Red Cross could be the convener of these workshops actually. Carry out initial research, meaning just the basic information that you need to answer those questions. So it is not very data heavy, and it will use whatever information you have. Set up the workshop, do the workshop, develop the plan, and sign off to the commitment. So that's what how it is used. And this is a typical agenda. It's a 3-day agenda. If you're using the scorecard and then the public health scorecard. But if you're using only the health scorecard, which is also possible, both at national and local level, then in that case it would be not more than 2 days. The online training that we offer, and we can offer it in any language, that is not a problem. The online training that we offer is 1 hour per week for 4 weeks. So, but we can adapt it. We can, it could be 2 hours per week for 2 weeks, or it could be 2 days in a row. It's up to you. But we normally provide 1 hour per 1 hour session per week. So people can do it along with their other responsibilities. It does not cause any additional burdens, and it is easy to use, simple. And as I said, by the end of this week, we will also by the end of this month, we will have it in English, in Korean also, and we can provide the training in any language that you want. So let us know. These are some resources which would also be useful for reducing disaster risk and working with the pandemic. And with that, that brings me to the end of my presentation. Just to introduce the tool and offer our services